Hemorrhoids are vascular structures in the anal canal. In their normal state, they are cushions that help with stool control. In some individuals, these anal cushions can become swollen or protrude through the anal canal, leading to what is commonly known as hemorrhoids or pile. So hemorrhoids are swollen veins in the anus and lower rectum. Hemorrhoids are similar to varicose veins. Hemorrhoids can develop inside the rectum, called internal hemorrhoids. They also can develop under the skin around the anus, called external hemorrhoids. Internal hemorrhoids are covered with a lining called mucosa that is not sensitive to touch, pain, stretch, or temperature. This is why internal hemorrhoids are painless, unless it protrudes outside the anus. While external hemorrhoids are covered by skin that is very sensitive. This is why external hemorrhoids can be painful and discomforting. Swollen hemorrhoids might come out of the anus and can then be seen as soft lumps of tissue. This is called a protruding or prolapsed hemorrhoid. Prolapse means protruding. Sometimes hemorrhoids are confused with anal skin tags. These are small flaps of skin that grow around the anus and can cause similar symptoms. The signs and symptoms of hemorrhoids depend on the type present. Internal hemorrhoids often result in painless, bright red rectal bleeding when defecating. External hemorrhoids often result in pain and swelling in the area of the anus. If bleeding occurs, it is usually darker. Symptoms frequently get better after a few days, though a skin tag may remain after the healing of an external hemorrhoid. External hemorrhoids can also be described as any of the following. Soft lumps that appear in bunches around the anus. A hard, red lump protruding from the outside of the anal area or could be mucus-covered bumps. Prolapsed hemorrhoids look like swollen red lumps or bumps coming out of your anus. You may be able to see them if you use a mirror to examine this area. Prolapsed hemorrhoids may have no other symptom than the protrusion. Or they may cause pain or discomfort, itchiness, or burning. External hemorrhoids can easily be felt with your fingers. In internal hemorrhoids, you can't feel them unless they protrude outside the anal opening. Internal and external hemorrhoids may present differently. However, many people may have a combination of the two. Even though prolapsed hemorrhoid come out of the bottom, you may be able to carefully push them back in yourself. They can also go back inside on their own, but, if left untreated, a blood clot may form inside a hemorrhoidal vein, obstructing blood flow and causing a painful swelling of the anal tissues. This condition is called a thrombosed hemorrhoids. Or, it may become strangulated if the blood supply is cut off. There are 4 versions of internal hemorrhoids. It's graded into grade 1, grade 2, grade 3, and grade 4. Grade 1, no protrusion, just prominent blood vessels. Grade 2, protrusion on straining, but spontaneous reduction. Grade 3, protrusion upon bearing down, requiring manual reduction, that is requiring you to gently push it back into the anal canal. Grade 4, protrusion with inability to be manually reduced. Hemorrhoids can present with discomfort and blood in stool, pain around the anus, itchiness, swelling of the vein and swelling around the anus. Sometimes, hemorrhoids obstruct the stool passageway and can further worsen constipation. In many cases, small hemorrhoids will go away on their own within a few days without the need for treatment. Larger hemorrhoids, however, cannot go away on their own and will require treatment. For some people, however, hemorrhoids become a chronic or recurrent problem. Usual onset is at age 45 to 65 years. While the exact cause of pile remains unknown, a number of factors that increase pressure in the abdomen are believed to be involved. Here are a list of predisposing factors. Or risk factors. Constipation, diarrhea, sitting on the toilet for long periods, pregnancy, obesity, anal sex, birthing a baby, chronic cough, low-fiber diets. Genetics like an absence of valves within the hemorrhoidal veins can make the hemorrhoidal veins become filled with blood and swell. Sitting for too long. Age or aging. Stress Straining during bowel movement, that's straining during defecation. Squatting while defecating. Pregnant women rarely need surgical treatment, as symptoms usually resolve after delivery. Hemorrhoids are usually self-diagnosable, meaning you may not need a doctor to diagnose it for you. It can be chronic, that means it can last for years or be lifelong. Hemorrhoids aren't a serious condition on their own. But leaving them untreated can be extremely uncomfortable and, if ignored for long enough, they could lead to infection and blood loss. If hemorrhoid bursts, an emergency care must be sought. The serious complication that is caused by excess blood loss or dizziness, faintness or even dangerously low blood pressure, leading to a condition known as shock. However, rectal bleeding can also be a particular sign of other disease conditions, such as colorectal and anal canal cancer. In many cases, small hemorrhoids will go away on their own within a few days without the need for treatment. Larger hemorrhoids, like grade 4 hemorrhoid, however, cannot go away on their own and will require treatment. Grade 4 hemorrhoids are prolapsed internal hemorrhoids which will not go back inside the anus. For treatment of grade 3 hemorrhoids and grade 4 hemorrhoids, doctors will often refer patients to surgeons for more serious hemorrhoid treatment procedures. An antibiotic is used to treat an infected hemorrhoid or infected tissue caused by a procedure to remove a hemorrhoid. On noticing that one has hemorrhoid, pile. These are things you can do to manage it at home. Drink plenty of fluids. Improve your toilet habits. Take sitz baths. Increase your physical activity. Use topical treatments. Apply a hemorrhoid cream or suppository. Take pain relievers by mouth. Avoid scratching, rubbing or excessively cleaning the area, this can make symptoms worse. Eat a high-fiber diet of fruits, vegetables, and whole grains. Foods to avoid. Low-fiber foods that can cause or worsen constipation and lead to hemorrhoids include milk, cheese, ice cream, and other dairy foods. Meat. Processed foods such as sandwich meat, pizza, and other fast foods. Elevating your legs off the floor reduces the pressure that sitting puts on your spine, rectum, and hips. So, try keeping a foam wedge of a rolled-up towel under your thighs to alleviate pressure from your rectal region. You can also use a footrest to get your feet off the floor if you are sitting for longer periods. Some gently push the pile back. How do you push piles back inside? Put on disposable gloves, and put lubricating jelly on your finger. Gently push back any tissue that has come out of the anus. Apply an ice pack to help decrease swelling. Be sure to keep a damp cloth between your skin and the ice pack so that the cold doesn't damage the skin. There is no quick treatment that can treat hemorrhoids within 48 hours. Symptoms often improve with at-home measures. There is no set duration for hemorrhoids to heal. If hemorrhoids have not resolved within a few days, it is best to see a healthcare professional for treatment. Ignoring your symptoms and treatment may prolong your suffering and it could get worse. So talk to your healthcare provider. If you have bleeding during bowel movement, talk to your doctor ASAP. Don't assume rectal bleeding is due to hemorrhoids, especially if you have changes in bowel habits or if your stools change in color or consistency. Not every symptom occurring around the anal area is hemorrhoids, so talk to your healthcare provider. Your healthcare provider may send you for colonoscopy or sigmoidoscopy to confirm the diagnosis and rule out more serious causes. If diagnosis is confirmed to be pile, your healthcare provider will assess the situation to determine the best possible management of the hemorrhoid. Treatment consists of diet modifications and laxatives. Increase fluid intake. A high-fiber diet can be effective, along with stool softeners. Local anesthetic, like cream, ointment that blocks the transmission of pain signal, can be applied to the anus. Hemorrhoid injection or sclerotherapy is one of the least invasive, painless treatments performed in the office. This consists of an internal, painless shut. That's because we have no pain fibers inside the anus. Another procedure treatment plan is rubber band ligation. In this procedure, a doctor places a special rubber band around the base of the hemorrhoid. The band cuts off the blood supply. The banded part of the hemorrhoid shrivels and falls off, most often within a week. Scar tissue forms in the remaining part of the hemorrhoid, often shrinking the hemorrhoid. Another is sclerotherapy. For this procedure, a provider injects a chemical solution into the area around the hemorrhoids. This solution damages the blood vessels, causing them to shrink and scar down. Another is electrocoagulation. This procedure uses an electric current to damage the hemorrhoids. Surgery is reserved for those who fail to improve following those measures. In some cases, a medical procedure to remove the hemorrhoid may be needed to provide relief. This procedure is called hemorrhoidectomy, and it is the most effective treatment. Hemorrhoids are common. There are notable people who had it. Former U.S. President Jimmy Carter had surgery for hemorrhoids in 1984. Hall of Fame baseball player George Brett was removed from a game in the 1980 World Series due to hemorrhoid pain. After undergoing minor surgery, Brett returned to play in the next game, quipping, "My problems are all behind me." Hemorrhoids do not cause colon cancer. Dispel myths such as, if they are left alone, they will turn into cancer. Thanks for watching. If you like this video, do give it a thumbs up and subscribe for more infotainment.